Ladies and gentlemen, good morning. My name is Riccardo Re, I'm a physiotherapist. I work for Casa di Cura del Policlinico di Milano, and I'm here today to present you the stroke use case related to the vCare clinical trial that was conducted in Milano between December 2021 and July 2022, and that involved the recruitment of 20 subjects. First of all, let me start by explaining what the aims of the clinical trial were. Then I will try to describe in which specific context in the stroke use case the vCare system was tested. And then I will try to show the most significant results that we gather at the end of the experiment. And then I will try to propose some I hope interesting insights and talking points for filling the clinical roundtable and discussion that will be open later. And before saying you goodbye, I will screen a short video interview documenting the perspective of one of our patients that tested vCare during this month of piloting. And I hope you may find it interesting, especially as a cue to stimulate the constructive debate among us during this final event. But let's start right away with the descriptive background of the stroke use case clinical trial. Where does vCare fit with regard to the traditional and ordinary rehabilitation pathway of stroke patients? Let's say that the focus addressing the clinical trial was try to fill that rehabilitative sinkhole that arises once a patient is discharged from the hospital, similarly to what happened in this Parkinson's disease in Spain, as presented by Rocio before. Therefore, continuity of care is the main protagonist, also in the stroke use case in the construction of this clinical trial. With these premises in mind, it's crucial that the purpose of the clinical trial here is not up to date prove the clinical effectiveness of the vCare solution compared to a traditional intervention. But in this moment, it's important to test its usability and the level of adherence. In other words, measure the level of engagement that this system could raise in the stroke patients, in the stroke population. Stroke population that, of course, firstly by age, is very refractory, first of all, to technology and to digital innovation, of course. So this is a great challenge. And summarizing here, I could say that the biggest challenge that we accepted to overcome was try to understand if actually up to date in this moment the real presence of a physical healthcare professional is essential in the delivery of a home rehabilitation service, or if a solution equipped with virtual coaching features could anyway empower motivations and support active and independent lifestyle at home. So let's go into detail of the clinical trial. This is the flow chart of the methodology. We build a randomized controlled trial, and we recruited 10 patients that tested the vCare solution for a period approximately from 4 to 10 weeks. And in the control group, we recruited other 10 subjects to which we delivered a protocol of self-administered calisthenics physical exercises combined with lifestyle guidance and recommendation to be performed at home. Both groups have been informed and trained at the use of their respective activity program during the period of hospitalization in the clinic. And now let's see which are the clinical evaluation that we administered to the patient before at the end of the intervention in both groups. We have the Euro Quality of Life 5-dimension for assessing the quality of life perceived by the patient, the National Institute of Health Stroke Scale for staging the level of symptoms and impairment of a stroke, And then we have functional independence measure, functional ambulation classification, and Montreal cognitive assessment to characterize the level of autonomy in the activity of daily life, their ability to walking without any particular walking aids, and to define their basic cognitive profile. But then a more in detail analysis was carried out for the vCare group. We assessed usability and satisfaction perceived with 3 scales, the user experience questionnaire, system usability scales, and technology acceptance model. And finally, we also try to explain, have a picture of the adherence of this patient in the daily interaction with each component and each activity tested through a series of indicators and parameters that are recorded and tracked by the vCare system. These are the activities that composed the vCare user group. Basically are grouped in 2 categories. The first activities are, we could call them primary rehabilitative actions, and are strictly prescribed by the clinical staff through the professional portal of the vCare solution. These are those actions that are primarily interested in the rehabilitative action compared to the traditional rehabilitation pathway performed in hospitals, and are the motor serious games sessions prescribed 3 times a week, and these are provided through a television connected with a 3D camera sensor and provided through a dedicated suite of motor serious games. Here the patient should perform games with task-oriented actions, and are addressed to different districts of the body, upper limb, lower limb, balance, and they are specifically customized in according to their specific disease that the clinicians found during the clinical examinations and added inside the vCare professional portal. The other primary activities are the cognitive serious games that are prescribed by our neuropsychological staff 2 times a week in accordance to the cognitive profile during the examination. These activities is provided through a tablet with a dedicated suite of cognitive serious games that are addresses to work on some skills like memory, like attention, executive functions, logic, and calculation. And then we have the second group of activities that are, we could call them additional, because are always on or on-demand action, not primarily prescribed as a rehabilitative pathway. And these are the e-learning on-demand video content provided through the vCare Avatar app for a series of video, educational, promotional, and about the risk at home, and informing through some tutorial how to perform physical exercises at home. And then we have the activity number 2 that is called Cognitive for Active Lifestyle, but basically is the way that we monitor the level of physical activities in our stroke patients through a wristband that is paired to the ecosystem of the vCare with the main application, the vCare Avatar app, and that monitors the number of steps walked by the patient during the day. But everything is strictly supervised and supported by our virtual coaching through a series of reminders, notifications, questionnaires, a specific and customized feedback for the patients. And now it's time to have a look into the final results that we collected. This first slide represents basically the patient characterization of the sample of patients enrolled. Here you could see the inclusion and exclusion criteria, but I invite you to have a close look to the both ethnographic and clinical profile of the stroke patients. 72.4 is the mean years old age. This means that vCare solution actually targets a population that, of course, is frail, but has an altogether low level of impairment, as indicated in the bottom of this slide by the 4 clinical evaluation scale administered to the entire group of patients. As you can see, we have a mild neurological impairment, not only for staging the stroke disease in terms of symptoms and signs in the NIH-SS scale, but also from a functional point of view, low impairment in performing the self-care activity during the daily life, and also to define their motor and cognitive status as indicated in the functional ambulation categories and Montreal Cognitive Assessment. Now here you could see the clinical evaluation scores administered to both groups before and at the end of their respective interventions. You could see the clinical differences in the pre and post intervention, and here I could report that both group trend is positive. But this positive trend is more consistent in the vCare group, especially in the domain of the functional independence measure, as to indicate how vCare improve the ability to perform the daily life at home of the stroke patients enrolled. But vCare also positively impact on the quality of life perceived, and in particularly in the domains of mobility, in the reduction of anxiety, and another time, the usual activities that is has a strict correlation of what outlined in the functional independent measure results for the clinical scale. So this is interesting to underline and emphasize it as a result from a clinical point of view. And now let's move to see how the vCare users assessed usability and satisfaction. Each of these 3 metrics reached positive scores in terms of usability perceived. And so most of the vCare user interviewed considered vCare reliable, user-friendly, both in the daily interaction with the systems, but especially in the perceived usefulness as a rehabilitative support. And this is an important message, I think, to underline as a result in terms of usability. Let's move with this representation of the adherence. Here are summarized some of the most significant outcome measures that the vCare system is able to track. And for each activity tested, you could see here the mean values of adherence in correspondence with the prescription. Here, what is interesting to emphasize that, for example, the cognitive serious games show an excellent adherence in comparison with the prescribed session. We reached a score close to 100%, so it's very, very appreciated by the patients, also in terms of adherence with this activity. Home-based motor activities, so the motor games, the motor serious games, engage a little bit lower, 66%, but I could say you that this difference could be explained because the cognitive games, first of all, are provided through a more portable solution, easy to be interacted, only a pad, and without physical exertion. The home serious game required an engagement that from a physical point of view. And what does it mean that this? Because this strictly emphasize how the motivation is important, something that could increase exertion, probably reach lower motivation for this patient. So this is a probably explanation of this a little bit lower, but however satisfactory level of adherence. And these are regarding the main primary activities. But also we gather positive and collected positive scores in terms of adherence for the vCare avatar apps, in the interaction with reminders, in the assess of each application of the ecosystems, in answering the questionnaires, the agenda, and the specific notification provided by the systems. Also, the learning video reached a good level of adherence, mean value greater than 50%. This slide basically depicts in a different way the adherence. Here are group for each single patient belonging to the vCare group, a gradient color that indicates how these patients are devoted to interact of each single activity and component of the vCare solution. And summarizing here, we could say that the motivation is a focus in this result, because the most evident thing here that we have a high inter-patient variability in terms of results. And I'm going to the conclusion of my presentation, and here I want to raise some discussions and talking points for the clinical debate. If we want to continue the process of validation of the vCare solutions. First of all, we should try to identify which is the ideal stroke profile recommended from a clinical point of view. Then we should try to consider as a scientific clinical effectiveness and good clinical practice to adopt quantitative metrics rather than qualitative, like for example time up and go, 10-meter walking test or 6-minute walking test that are objective indicators that could clinically and statistically have a significant difference between pre and post an intervention. And also regarding the usability issues that we experienced during the test, the results suggest also to have a careful analysis of the best hardware that could tailor the motor and cognitive disabilities, and also to consider an improvement in the software optimization, like for example simplification of the user interfaces or adopting shortcuts that simplify the interaction of these elderly people. And last but not least, planning environmental infrastructural visit at the patient's home in order to verify the appropriate network and the presence of safe and free workspaces. Also, not forgetting the adherence. So for supporting the patient's learning curve, we should plan individual or collective educational programs and support the trust that the patient has in their healthcare provider through telephonical or physical follow-up. Before farewells, I'm pleased to bring here the statement of one of our patients that tested the vCare solution. Juliana, here in this short video interview, pleasantly wanted to revisit her experience with vCare, so let's see what she has to tell us. Thank you for listening.
Mi chiamo Giuliana De Carli, ho 87 anni, abitiamo in questa casa dal 1961 e 2 anni fa ho avuto un ictus. È stata dura la cosa, non mi riconoscevo più. Ho fatto una decina di giorni al pronto soccorso di Niguarda e poi sono stata mandata al Dezza per la riabilitazione. Sono felicemente tornata a casa, era come arrivare da un altro mondo. Mi sono sentita un po' abbandonata. Era diverso che essere in ospedale dove veniva un fisioterapista a prendermi.
Perché hai accettato di partecipare al progetto vCare?
Sono molto felice di aver partecipato a vCare. Volevo star bene, volevo migliorare la mia situazione, speravo di ritornare quella di prima e ho capito che sarei stata aiutata in questo.
Giuliana, tu non hai molta esperienza con la tecnologia, vero?
Assolutamente no.
Ecco, e com'è stato dover imparare a utilizzare tutti questi dispositivi?
Beh, è stato faticoso. Basterebbe avere qualcuno che ma come si fa a fare tal cosa? E me lo spiega al momento. Quando sono nata io non avevamo neanche il telefono in casa e pensate un po', in quasi 90 anni.
Qual è stata l'attività o la funzione che più ti è sembrata interessante ed utile fra tutte quelle che hai provato in questi mesi del progetto vCare?
Mi era piaciuto il gioco delle lattine e ero diventata anche molto veloce. Scendevano i fiori oppure gli insetti e io dovevo colpire.
Che cosa invece avrebbe bisogno di essere perfezionato?
Ma per esempio l'orologio. Non era male l'idea di avere il numero dei passi giusto, perché io l'avevo sul mio telefono.
Ti sei sentita adeguatamente seguita e stimolata durante questa esperienza dall'assistente virtuale?
Povera, forse non lo so cosa le mancava, ma io mi aspettavo che la signorina mi desse delle indicazioni precise. Dovrebbe praticamente ragionare come un fisioterapista. Dovrebbe farmi fare delle cose utili per il mio recupero.
Cosa chiederesti a tutti coloro che nell'ambito della ricerca stanno cercando di portare innovazione tecnologica nelle cure riabilitative di persone che come te si trovano in una condizione di fragilità?
Mi sentirei di chiedere di insistere, perché sarebbe molto molto utile per il recupero delle persone come me. Un saluto a tutti. Ciao!